Hello, and thank you for downloading the Elite Medical CPD app. It's been put together by myself, Richard Fletcher, here at Elite Medical, and I'm making it for really all staff to use, all clinical staff. So whether you've just joined Elite Medical, then you're more than welcome to download the app and crack on. If you're on your FREC 3, FREC 4, or you've done your medication course as well, more than happy for you to use the app and record any CPD that you do. Now, as clinicians, we are all very good at doing CPD. We do it on a daily basis. We talk to patients, we treat our patients, we document events. What we don't do very well as clinicians is record this. Now, this app is designed so you can pick it up quite quickly, go straight into a form. Hopefully, if you're at an event, within 10-15 minutes, you could complete one of the forms, upload it, and it will be recorded on your personal file as CPD. This is something with a QualSafe request for all FREC 3 and FREC 4 staff as well. So on the app, you'll find different areas. If you would like to set yourself an objective, you can do. So obviously, it has to be within reason. If you're looking at doing a doctorate, then that's quite a large objective. But if you would like to look more into patient care around cardiology, then please set those objectives and a realistic time frame to get that objective completed in. There are also going to be some courses on there. I've got a free course already on knife wounds, so you can have a look at the course. You can apply for it. It's free of charge with pro trainings. You can complete the course, and then there's a form to follow that up, which means you can record what you did on the course, what your findings were, what you learnt, what you took away from it. You can also get peer reviews done. So if you are at an event, let's say working with a paramedic, you do your first MP airway, then you can have your paramedic observe you, and after the event, you can also get the paramedic to take hold of the phone there and document exactly what went well, maybe what didn't go so well with the incident, but of course you will learn from that. There'll also be at the bottom an ECG on there. We're going to put that every couple of weeks. The ECG will go up. There'll be little comments at the bottom there about how the patient's presenting, and it's for you just to really have a look and research into the ECG. I'm hoping to improve on this as well, where you'll be able to post comments in at a later date, and people can sort of have a forum site where people can add, and you can sort of argue your thoughts through on each of the ECGs. I'm also going to produce some Fletcher's lectures. So these are going to be videos that I produce. There's obviously no copyright issues, but we're going to focus heavily on equipment we have here at Elite as well. So if it's a Kendrick splint, for example, I'm keeping the lectures down to 3 to 4 to 5 minutes. They're nice and short, but they'll be really informative. You can obviously reinforce your understanding or knowledge, and then you can also get one of the forms afterwards and complete a reflective writing on that. Okay, I'm just going to show you now around the site itself. Thank you. So here is the home page of the app. Top left hand corner, you will find the 3 lines. Click on that, it will take you to the main headings of the app. So we come out of that, back to the home. We have here my personal development plan. Click on that, push on that, you'll get a form. At the moment, it's just the one form. We will be adding second and third form for your main objectives. Now, an objective is where you would like to achieve something within your sort of vocation. So maybe you would like a little more or better understanding of ECGs, for example. So you could set an objective of to understand the basics of ECGs, and you could give yourself a kind of a timeline to have that completed within. So if you were to open that form up, we can read through the main paragraph of the text there. You're going to pop in your information, your email. You're going to give this objective a name, so basic ECG understanding. Put in a date objective set, which should be today's date, and you click on the date there, it'll automatically pop up. Main objective heading. Now, this is important to pop this down. So if you give it a nice simple sort of 3-worded title, the future forms that will come on here, say maybe a midpoint form, means that midway through your completion of this objective, you can write about how things are going and what different avenues you've gone down through. There'll also be a form when you've completed your objective, and you can write up about maybe how it's changed your sort of professional working. So here they are, they're smart objectives, so they're measurable. they're achievable, they're relevant, and you're going to make them within a time frame as well. So we come out of that and back to that main page. We've now got record my CPD. So here currently got 3 forms. There again will be more documents coming into this later. Obviously this is very early stages, but course CPD. Now if we click on that, if we're to complete a course, let's say you've joined Elite, you've gone on to the first time you've done a FREC course with them, a FREC 3, and you've completed that course, then you can pop your name in there, your email will go in, data completion, so when you've got the certificate of the course ideally, so course data will be FREC 3, course provider will be Elite or Sales, and then you can upload your certificate in here as well. So please explain the outline of the course, so you can give that a brief heading of what the course entailed. Obviously we know what the FREC 3 does entail, but if you are to find external courses away from Elite, then please put those down, and anything really relevant to working as a medical provider can be put down on here as well. So even if it's working with, let's say, radios and communications, that is all beneficial to working with Elite events. So pop those sorts of courses down on here. Did you complete the course feeling confident with the objectives? So you can add a bit more detail in there. And on the completion of the course set, have you got any future learning objectives to complete? And how relevant or beneficial was the course to supporting you in your job role? So you can put all the details down on there. Clinical practice CPD. So we click on that. Let's say you're at an event and you do your first NP airway on a patient. Now here you can pop down your details again, data completion, the day you completed that NP airway. Now browsing files here, obviously there's not going to be a certificate that you're going to be awarded for this. However, you may, on certain instances, let's say you do a nice dressing on a patient, it's quite complicated, let's say it's an open fracture, you could argue that if you were to take a photograph of that, you could upload it onto here. Now we've got to be a little bit careful what you do upload onto here. We don't want anything that identifies the patient, so no paperwork, no documentation should include any patient details, certainly no facial features of a patient, or if they're at a home address, anything of private property. So make sure you keep well away from those. Please explain the outlines of the incident you're reflecting on. So let's say it was this open fracture, you could just have a brief description where someone's fallen out of a tree, landed on the leg and got a mid-shaft of femur, open fracture. Reflective writing, you can give all the history, put it all down in there. What went well? Maybe what didn't go so well. And every job we do, things don't always go well. And this is where we need to really recognize this. And this is where we learn hugely in the medical profession with mistakes or things that haven't gone so well in the past. So we identify those and we reflect on them, and we obviously improve for the future. So once you've submitted all of these forms, they do go onto a database. I can access them as well, so we can look into them, and they're filed away. Peer review. Now again, for your event, here you will have to pass your phone over to your peer. If you're FREC 3, a peer could be a FREC 4, so anyone really at a skill grade, maybe at your level, that's absolutely fine, or a level above as well. So you're going to have a little text here for the person who's writing the review and for the person who owns the review. So in the top box here, this is completed by the reviewee, so they would put their name down, say Richard Fletcher, email address for that person, date of the CPD being done, what is being reviewed. Let's say we go here, so a medical management, a trauma management, skill use, equipment use, scene management. Otherwise you've got other in there as an option. Let's say it's a driving thing that we're going to do. Again, any files that can link you into this, photographs can all be uploaded onto this as well. Just again, be very careful about patient confidentiality. Please use this to write up a peer review, so they will write in there blah blah blah, such and such and such, and then they will what learning has taken place, and they will, the paramedic or whoever's doing the writing, will sign their signature there to say, oh, there we go, say that it was completed by them at that date. So the owner will then take over. How would you rate your overall performance? Don't completely dismiss yourself. So things didn't go well. You've recognized them. That's great. So give yourself an honest bit of feedback there, and then you can add to that performance rating with the text box below. So they are your CPD forms. Like I said, they will you will get more. Elite trainers, do some CPD. So let's click on this one. So CPD, another form here. So if you do some CPD, lets you read some books, you do a little course online, you can put your name in there, details again, and then again you can follow through the form nice systematically and record all CPD. We as healthcare professionals do CPD all the time, but we just don't record them. So on here we've got some CPD resources. So a lot of these from the British Heart Foundation, the Research Council guidelines, the interactive videos at the bottom there. So you can click on that. This will take you to their website and will allow you to watch their videos where you can interact. So maybe someone collapses and you have an option of, do you call for an ambulance or do you open their airway up? So it's a really good sort of program, and then you can write up your CPD after that. So elite trainers, this is still a work in progress, so I will add to this shortly, but if you click on there's my picture, one of me, and there's obviously an email, contact me, but I will add all the additional elite trainers into there as well. ECG of the fortnight. So there you can see we have an ECG, a 12-lead ECG. Down here, there is also a bit of text talking about our patient, 39-year-old female. And here you can just have a look at the ECG, have a look at the signs and symptoms, the history presenting to this ECG, and then you can have a little bit of a self-study. And again, CPD reflect on that as well. I'm hoping to increase this to having some text boxes below, so you can leave your comments and thoughts, others can read into that, and we can get some discussion going over the ECGs as well. Now, if we look down to the bottom of the screen here in orange, there you've got lectures. So if we open this up, here there will be eventually a nice long list of different lectures that I'm going to produce. So we open those up. You can watch these videos. I'm going to keep them down to 3, 4, 5, maybe a maximum of 10 minutes. These lectures may be doing observations on a patient, using some of the elite equipment. So when you have watched the lecture, you can watch it as many times as you like, then you please do pick up a CPD reflective form, write down exactly what you have learned, what's reinforced, and then we can record some CPD.